Should assisted suicide be legal for people who suffer from a terminal illness? Picture yourself or a loved one with a terminal illness. If it's a brain cancer or a rare genetic disorder with no cure, think about what you would do. Would you want to see your loved one suffer or have them watch you suffer? If you asked me 5 years ago, I probably wouldn't be for it. Being a daughter and a friend of people who've committed suicide because they didn't want to deal with their problems isn't my opinion on the best way to go. Now, I'm all for it. I believe that it's everyone's right to make the decision for themselves. Being a mother of a terminally ill baby, I have seen what it's like and what someone close to me has gone through, and I would never want to see that again. Brittany Maynard decided to end her life this way on November 2nd of this year. Brittany had a brain tumor called glycoblastomia. Glycoblastomia is a type of astrocytoma, which is a cancer that forms from star-shaped cells in the brain called astrocytes. In adults, this cancer usually starts in the cerebellum, which is the largest part of your brain. Almost 1 in 5 tumors that start in the brain are glycoblastomia. Glycoblastomia tumors are usually high malignant or cancerous. They are grade 4 tumors, which means they can grow fast and spread quickly. Glycoblastomia tumors make their own blood supply, which helps them grow. It's easy for them to invade normal brain tissue. There are 2 types of glycoblastomia. There's primary, which is the most common. It is a grade 4 tumor and it is very aggressive. The second one is secondary glioblastoma, which starts as a grade 2 or 3 tumor, which grows slower. With their own blood supply, it eventually becomes a grade 4. About 10% of glycoblastomias are this type. They tend to happen when you're 45 or younger. Because glycoblastomia grow quickly, pressure on the brain usually causes the first symptoms. Depending on where the tumor is, it can cause persistent headaches, seizures, vomiting, trouble thinking, changes in your mood and personality, double and blurred vision, and trouble speaking. Brittany was already experiencing all of these symptoms right before she decided to end her life. She still had a few months left to live, per her doctor. She had seizures that would double her over, and she would not be able to speak or remember anyone afterwards. A medication she was on would make her gain so much weight to where she did not even recognize herself. She even said that she stopped looking at herself in the mirror. Seeing the first video of her that became public to the final video was astounding because she looked so different. I personally didn't think that that was the same woman. Brittany knew she was going to die and did not want her family to see her experience the pain the doctors described to her. Brittany became an advocate for death with dignity. Death with dignity is an option to end life for mentally competent, terminally ill patients with a prognosis of no more than 6 months to live. As of today, death with dignity is only in 5 states in the United States. Oregon, Washington, and Vermont have laws allowing a physician to prescribe a lethal dose of medication following certain protocols to terminal patients. Based on a recent court ruling, although the state's attorney general is appealing this decision, terminally ill New Mexico patients have a state constitutional right to obtain aid in dying. Montana doesn't have a law with a set protocol, but a previous court gives physicians protection if they write a prescription for a legal dose of medication at the terminally ill patient's request. Over 750 patients in Oregon have chosen euthanasia since the Death with Dignity Act went into effect in 1997. Advocates for assisted suicide state that aid in dying does not replace palliative care and allows the patients to die before their suffering becomes unbearable. But opponents argue that terminally ill patients may be pressured by others to end their lives prematurely. I completely understand Brittany's decision and where she was coming from. She tried everything to be able to live her life longer, but God had other plans for her. When she came to terms with her diagnosis, she lived her life as long as she could with her illness, allowing her to do so. She explored. She did things that most of us have never done. She became an advocate for that short period, but she has reached out to a lot of people because of it. She ended her life the way she wanted her family and friends to see her. She did not want them to remember her suffering or that she was giving up in any way. You feel so helpless when you see a loved one in pain. I have witnessed firsthand seizures that lasted hours, numerous hospital stays, being poked millions of times, and seeing the pain in your child's eyes that you wish you could switch places with them. Watching them throw up even when they haven't been able to keep anything down. All the medications a person or child has to take to try and simmer down the pain they feel 24 hours a day. I absolutely loved every minute I had with my son during his short life on earth, but I would have done anything to help him feel more comfortable. Having to make the hardest and stomach-wrenching decision of my life to let my son go, watching him suffer those last few days was worse than making the decision to let him go. Those images are embedded in my memory and follow me everywhere I go. She did not want her family to remember her this way, and I would never want anybody to remember me that way. If I was in his shoes, I would want to make the decision to use assisted suicide from a physician because I would never want my family and friends to see the way I had to see my son. I do feel, in the case of an infant or child, since they cannot decide on their own or know what is in their best interest, that there should be steps the parents have to make before coming to the decision to use assisted suicide for them. I feel it is everyone's right